Hey, what's up, everybody? Welcome to the Move Better podcast. I am your host, Dr. Joe Jaime, here at Spine Health Functional Therapy. I'm a sports chiropractor, and here is my host for today, my co-host for today, Mark Valderama. He is our massage therapist, our sports massage therapist over here in Daly City, and has over 19 years of experience, has seen multiple people and multiple conditions over these last few years, over the last 19 years. And he's here to talk to you guys today about TMJ disorder, or we will be here talking about TMJ disorder. Some of you guys might be dealing with some injuries in the jaw. Sometimes you guys might have found that you guys have been chewing off and it's starting to affect multiple systems in the neck and the head. Today we're going to be talking a little bit about how and why that happens. And we're going to go over some issues that you might be experiencing and how to fix them. All right, so today, Mark, right? It's not just massage therapy, am I right?
Yeah, I mean, primarily my title is licensed massage therapist, but I have certifications in active release therapy or active release technique, instrument-assisted soft tissue mobilization, functional and kinetic therapeutic rehabilitation. There's too many acronyms, but all of them are dealing with soft tissue and soft tissue dysfunction.
Every letter of the alphabet is what you got under your belt over here. So what separates you from a massage therapist? Why can't I go to any old spa treatment and get that type of work done, like the jaw work?
It's a little bit more specified, right? Mm-hmm. So typically when you're trying to work on something specific in terms of like an injury or soft tissue dysfunction, you want to make sure that the person working on you is trained. You're not going to typically get that from a standard massage therapist for the most part, unless they've gone through the proper training.
Okay.
Right. Okay. So when you go to massage therapy school, like I did in 2003,
it's
right?
A little while ago.
Yeah, it was a while ago. But I mean, they teach you the basics in massage therapy school, and your focus is on more kind of like spa-related things. Mm-hmm. So it's not going to be very injury-specific or dysfunctional-specific type of work.
Okay. So when you're in a sports massage therapy office, that's what you expect to see. You expect to see more treatment based on specific injuries. Is that always the case? Well,
much like our office here, right? So people come in with specific types of injuries, whether it's joint-related or muscle-related or soft tissue-related. And when we talk about soft tissue injuries or dysfunctions, we're thinking about the 5 different types of soft tissue. It's muscle, ligament, tendon, nerve, fascia, and all those different layers. Fascia. The fascia.
Fascia.
But, you know, when we're dealing with those things, you want to be very specific in terms of trying to get a person back to a normal state faster, right? Okay. So you kind of want to know what you're doing.
Yeah. And normal state meaning free of pain.
Yeah, exactly.
Movement, smooth movements.
Normal range of motion.
Things that can't bother you. Things that won't bother you in your day-to-day life. That's what we would consider normal, right?
Yep.
Although there's different levels of that, but that's for another talk later on. But TMJ is one of the reason why we wanted to choose this topic was because it's becoming more and more popular within our office, and we've been noticing a lot more people coming in with some of the with a jaw problem, a chewing problem, a neck problem that's causing jaw pain, and that's causing other areas of the head and neck to start to become dysfunctional. And the TMJ is something that's often overlooked by a lot of practitioners, right? When treating a clicking or treating some type of injury here, there's a lot of practitioners that are kind of confused on which routes to go when to treat that. And what we have over here at Shift is we again, in the past, we've talked in different podcasts about why we do the things that we do when we do a full exam, full assessment on everything that's going on, from the person's story all the way down to the plan, right? We need to figure out everything in between in order to diagnose and treat the person. And so with a TMJ disorder, there are multiple ways that a person can have it. And in your experience, what have you dealt with people that have had TMJ? What do they normally complain of?
Different type of reactions to stress. A lot of times when people are asleep, they just tend to lock their jaw. They tend to bite down while they're asleep. They don't even know it. And they come in, they're just like, man, my jaw is sore, my jaw's hurting, or there's clicking, or my jaw's pulling to one side or the other. So for what I do as a massage therapist, I'm looking for differences in texture, looking at the range of motion as they open and close their jaw. And then I start to palpate. So palpation means using your hands to kind of find abnormalities in what the tissue should feel like, right? So I'm looking for how their jaw tracks. I'm working on the outside of their jaw. So when it comes to TMJ, the muscles that we're looking at are the mastication muscles, the chewing muscles, which are the temporalis muscle up here, kind of follows through the cheekbone, through that zygomatic arch to the masseter, which lines on the outside part of the mandible. And then inside you have the lateral and medial pterygoids.
Should we use this guy right here?
Yeah.
Okay.
So we talked about the temporalis is a muscle out here. It's going to run through that cheekbone down into the mandible, and that's the masseter down this way. Now the pterygoids, the lateral medial pterygoids, are actually in here through that arch. So it's going to follow through up
Can you guys
through
see
the
that?
backside of that jaw area.
Explain that again one more time.
So in here, you have the medial pterygoid that runs slightly vertically down to the mandible, and then the lateral pterygoid runs kind of almost horizontally across to the backside there. And so, you know, to get to those pterygoids, do I have to get inside your mouth? Yeah, I do. So I'll throw on some gloves, get in between your teeth and your cheekbone, and just kind of start working on some of those muscles if that becomes an issue of dysfunction.
Yeah.
So
So with TMJ disorder, a lot of people, for those that don't know what that is, the TMJ is basically right here. It is right here. It's right along the right next to the ear, and so that little hole right there is the ear, and this part of the jaw is the TMJ, right, the temporomandibular joint, and in that joint there's a disc, and if you look closely right there, there's kind of like a little pad right there. Well, I guess that kind of represents the TMJ. Now the TMJ is set as a bilaminar disc, meaning that there's two little small discs that are involved with that joint, and it lies right on top of that pointy tip right there. And so on each side of that, in each side of the tipping point, you'll have, like, let's say this is the point of the TMJ, you'll have a disc on each side of that connects that allows the jaw to move, open and close. Now, when there's a dysfunction there, and let's say those two discs, the two discs are on one side, let's say it's on the front side or the anterior side of the jaw, then you're going to start noticing things like clicking, or crepitus, clicking in the jaw. You're going to notice that it deviates to one side at one point, and then all of a sudden it pops and it clicks back in, and you'll see that a lot. That's probably the most common type of dysfunction that we do see, is based off of the way the discs are being held. Now, the way the discs are in the front of the jaw, and you'll hear clicking, popping, and then there's sometimes pain that's involved with it. Now, what Mark was talking about with the muscles, the reason why we need to really focus on the muscles is because the muscles are going to help control the jaw. Now, if there's a slight dysfunction, you're going to start creating dysfunctional patterns with the jaw as you open and close it, right? So the muscles will start to learn that very specific type of pattern, and that's something that we want to work on, to whether it's to stimulate muscles or to slow down the tension of muscles, right? And as therapists, we look at the movement of the jaw, whether we're looking at what Mark was talking about, those pterygoids, or we are looking at the temporomandibular muscles and the muscles of mastication. those all have a role in the way the jaw is going to start to glide. So we want to try to normalize all of those tissues as much as possible first before when they send it out to the chiropractors. Now, the whole reason why we want to work with them as chiropractors is because we've seen a lot of great movement with the jaw after an adjustment. And sometimes it may look a little intense when we adjust the jaw, but most people, and I'm not messing around here, is about 95% of the people love the adjustments. Some of them, even though they get adjusted, they still feel a little afraid of it, and that's totally understandable. That's totally fine. But it may look intense, but it's a very gentle adjustment on the jaw. And so one of the things that we do when we do the adjustment is it kind of normalizes the discs as the discs in the front part of the jaw. So it kind of normalizes where those discs are placed on the TMJ. So you won't have as much, and I'm not saying it's going to clear it all right away, but it's, just like with any other manual therapies, we've got to take our steps to be able to fix it over time. It's not going to happen overnight. Some you may have in a miracle adjustment, but most of the time you have to work at it. Okay, so major signs of TMJ or TMS or TMJ disorder, whatever you want to call it, are a few things. Mark, you told us that one of the major signs of the subjective or the patient is they deal with stress, right? What else? I mean, we have pain. I said we have popping and clicking, and you said grinding of the teeth, correct?
Grinding of the teeth, behavioral patterns, right? Chewing on one side or chewing gum, or, people have a favorite side to chew on sometimes, right?
Yeah.
So they overwork one side of the muscles, the other side doesn't get as much work. So there's an imbalance there. So sometimes you'll get just a dysfunctional side in terms of soft tissue, right?
Yeah.
Again, it may not even be the joint, it could just be really tight muscles on one side. You work on it. And much like Joe was saying, things don't necessarily heal after one visit. You're looking for levels of consistency. Much like when you go work out, if you're trying to build bigger biceps and you work out one day, is it going to make your biceps bigger in one visit? No. So same thing with body work. Yeah, it'd be nice. Just work out one day and you're great for the rest of your life. That'd be nice.
Who was that? Was it The Simpsons or Family Guy where he only worked out one side and he was all buff on one side? Do you remember that?
Yeah. No, that was Family Guy.
It was Family Guy, and he was all buff on one side the whole time.
Yep.
All right, so the major signs of TMJ disorder, TMS, is pain, crepitus. You'll have headaches. A lot of people start to deal with dysfunction with headaches. They'll feel pain on one side, on the temporal lobe, of headaches on one side, or sometimes it'll come across and above their head, right over here. So, sometimes the TMJ can come from the neck, from the cervical disorders. Ringing in the ear, right? Sometimes you'll have some what we call tinnitus, ringing in the ear, some dizziness, some muscle weaknesses around the jaw, and then finally, ocular pain, right? Pain around the eyes. Sometimes you might be feeling some dysfunction around there. So if you have any of those symptoms, go get checked by a professional. Hit us up. Let us know how we can help you. And again, if you guys are not in San Francisco, the Bay Area, or Daly City, you might be able to reach out to us, and we might be able to do a FaceTime call, and we might be able to help you out through FaceTime or on a meet. Okay, so hit us up. We'll be able to help you out. A couple of the dysfunctions that we do see: anterior disc dysfunction. Like I said before, that's probably the most common that we see. Is it right in front of the jaw? Posterior jaw dysfunction or posterior discs. A lot of the time how that happens is when you're at the orthodontist, the dentist, and they have your jaw locked out. And they put a device in there and it just kind of keeps your mouth open so that they can do all of the work that they need. And sometimes what sucks is that your mouth is open for a few hours, which creates a lot of tension within the jaw, and the discs start to go posterior to that instead. And the symptoms that you'll find is all of a sudden your teeth don't go back, They don't fit normally anymore. Your chewing is a little off, and then that will start creating more dysfunction. And most of the times, after an orthodontist visit or the chewing is a little off, people can deal with that for months and try to figure out how to fix that. And a lot of the times they don't, and that starts to create a cascade effect of dysfunction, of injuries, such as the headaches, the ocular pain that I was talking about, the temporal lobe headaches, the tension headaches that are coming from the back of the head. Because again, all of those muscles are trying to get control, and you start to get a little bit of a spasm in the jaw. That transfers over towards the back, and it starts to irritate. And then all of that inflammation that settles in that area, it starts to create a dysfunction of the nerve, what we call the trigeminal nerve, and it kind of has like three roots to it. And if you think it kind of comes up from back here, and it goes and it controls the jaw, and it controls the muscles of the cheek, and it controls the muscles of the head. And so if you start to have some pain there, or it starts to ring in the ear, that nerve is really starting to get irritated just from all of the muscles in that area. And so that's something that we would want to work on, right? And that's where Mark comes into play. He'll start working on some of the soft tissue. We come in as chiropractors to do some of the adjustment. And our exercise therapists, our specialists, will work on some of the rehab tools with retraining your movements and closing your jaw again. So it all depends on the person, whether it's coming from the back first or the jaw, or whether we need to work on the jaw first and then the neck. It all depends on where maybe the stress lies, like Mark was talking about. But maybe it started from the neck and moved to the jaw, or maybe you were born with jaw pain and now it moved back towards the neck, and now the neck is becoming more and more dysfunctional as you get older. So it all depends on where that is. The big thing, the biggest part about all this, the biggest takeaways is being able to talk to a professional and being able to explain your story of how it happened and why it happened. From there, we take it another step to be able to figure out where and how we can treat that. So next on the list, we're going to be going through how to fix it, right? Some home remedies that you'll be able to take and be able to do on yourself that will be able to relieve some of that pressure, just in case you needed to be able to help yourself out now before you are able to come into the office. So Mark, what are some home remedies that somebody can utilize in a massage therapy standpoint, in a soft tissue standpoint? What are some therapies that a person can do at home when they're dealing with some type of dysfunction like this?
So what we probably want to do is start off with like superficial muscles, right? We're not going to have people reaching into their mouth to kind of work on some of those muscles inside. So we think about it top down. Think about the temporalis muscle, which is basically on either side. Again, it's this kind of larger muscle that comes down through the cheekbone and then down into the masseter, down through here. But for the temporalis, it's pretty easy, right? You can take both palms, just kind of press on the top side of your head, and you can do...
On what side, on what part of the head?
On either side, right here.
On either side. Okay, so not on the temporal parts, not on the soft part,
not
a little higher.
A little bit higher, just on the kind of the belly of the muscle. So, and I'm going to take my hat off so you can see this. So, since I'm bald, you can see the temporalis muscle. As I bite down, you're going to see that muscle flex.
Right there.
So, pretty easy. You're going to find the temporalis. You're going to place your palms. You don't have to squeeze very hard or anything, but you can kind of press down and then just kind of open and close your jaw, which will kind of stretch those muscles. Now you could also do circles forward while opening and closing the jaw.
How do I do it fast or do it slow?
It's basically up to you. Like how much pressure you use and how fast you kind of rotate will kind of, it's up to your preference. Like how does it feel, basically? If it hurts, don't squeeze as hard. If it doesn't feel like anything, add a little bit more pressure. But again, you can do circles forward, circles back while opening and closing the jaw.
And that would be considered like a pin and stretch. Is that correct? Yeah.
Basically.
So when you put pressure into that area, that kind of helps with the muscles that go all the way down. Correct.
Correct.
Cool.
And then if we're going to go a little bit lower into the masseter. So as you bite down again, you can kind of see that muscle flex. Pretty easy way to kind of treat that, again, kind of superficially, is you're going to take both thumbs on either side of the jaw, and you're just going to press up as you slowly open the jaw. So as you're drawing down...
I understand how we look right now. So you guys are all going to be doing this stuff too. So
everyone's like, this looks really weird.
Yeah,
but
I know. It looks
works.
weird on camera, but you just hide away,
Yeah.
do it in the corner or something. But
do it without people around you. But as you do this...
Do that one again? Go on, Joe. See that one.
So as you draw tension superiorly or push up, you're going to open the jaw. Open the jaw slowly. And you're just going to feel that muscle traction, right?
Oh, that feels actually really good.
Feels nice, right?
What does traction mean?
Tractioning is basically trying to create a little bit more tension using pressure. So as I'm pushing down on the muscle and opening the jaw, I'm creating more of a stretch on that soft tissue.
Oh, that feels good. I mean, normally when you try to massage yourself, it really never works, right? You're always like, you're like, come on, massage myself. It doesn't really work. But actually, when you work on your face, it does.
Yeah,
it does feel pretty good.
Loosens up pretty quickly.
Yeah, I always make fun of my wife about this stuff because she always has these like weird rollers, and she's like rolling her face with it, and I'm like, what the hell are you doing? And I was like thinking about it, and I'm like, you know what? That's actually a really good tool. Like women have it down, man. That take care of their skin. My wife takes care of her skin a lot, really well, and she has this gua sha ruler.
It's a jade roller.
Yeah, it's a jade ruler. I don't know any of these things,
yeah.
But she has it, and she's rolling her face out, and I'm sure that can actually help as well, right? You'll find these little fascial rollers on Amazon online, or anything like that, and I'm sure they're pretty cheap, that you could utilize to just roll the muscles of your face. Yeah. That can actually help TMJ disorder, right? Because when we think about, if we really want to dive deep into the sciences behind a lot of this stuff, is, we're thinking about the communication pathways and muscles and nerves, and everything has receptors. Everything has little sensors on there, and when you change the perception of those receptors, that can have an effect on the brain, and actually can downregulate pain, can downregulate dysfunction, and all of a sudden, it seems like a magic trick when we're working in the office here, because we're also playing with like brushes and stuff too. Yep. Some people are just like, wait, how the hell did you do that? That's just because all we're doing is playing with receptors and how your brain actually perceives the area. Yep. So those gua sha tools are definitely some things that you can utilize in order to kind of downregulate the pain and clicking in the jaw, and sometimes might even clear up a few things. So definitely some good tools to work on the muscles. One of the things that I had was, when we were talking about neck and where it comes from, TMJ disorder might come from the back of the neck, or it might come from the TMJ. We talked about working with the muscles around the outside, but the back of the neck, right? One of the things that I like to utilize is our eye movements. And like I said, TMJ can also create dysfunction within the eye, within the ocular region of the head. And if we can move our eyes left and right, or just move our eyes around, because sometimes we might be so dysfunctional and looking into a computer or a phone or a book, we might be so engaged into that, and we don't really utilize the muscles of our eyes. And that's very important, because that also has an effect on the neck muscles. So if you just place two fingers and you place it on the back of your neck right here, I'm going to show you guys the back of my head right here. You guys place it right on the back of your neck right there, and you just move your eyes left and right. If you're just moving your eyes left and right, you'll start to feel those muscles start to move. And those muscles are planners, right? So anytime I move my eyes, the muscles of my spine, the stabilizer muscles of my spine, they try to stabilize the spine before I try to move my neck, before I try to move my head. When I do that, that can actually help downregulate the stress from my neck. So if you're starting to deal with like headache pain or temporal pain in this area because you're starting to deal with tension headaches, one of the things that I like to do is I place my hands back there and I put pressure onto those muscles, almost like I'm foam rolling it, right? Or I'm creating a pin and stretch, or creating tension or traction along those muscles. And then from here, I simply just move my eyes left and right. And when I do that, I'm kind of stretching out the muscles, the deep cervical muscles of my neck, and that will actually help me to relieve tension around the jaw as well, and those headaches that you might be dealing with. And again, get checked, but some quick things that you guys might be able to fix at home is try doing that. Or grab 2 lacrosse balls, place it on the back of your neck, lay down on them, and then just move your eyes left and right. Or move your eyes up, down, left, right, diagonally, obliquely, whatever it is. The more you move your eyes without needing to move your head, you're actually going to start to release tension within the neck. All right, so those are some ways that you guys can deal with some of the stress, down-regulate the way the muscles are spasming out, creating pain, whatever it is. Release tension off of the jaw, the temporal muscles of mastication. Try to relieve that as much as possible, just like Mark explained to us over here. And then again, utilizing that pressure on the back of the neck, moving your eyes left and right, trying to release tension within the neck as well. And that will also make some changes within the TMJ. Pretty cool.
So as you open and close your jaw, is there any tension that you feel as you open the jaw?
Like right at the very
Right at the joint?
yeah, like
Not higher up, but just right at,
Like
as
right
you
here.
bite down?
like
Okay.
at the very most open.
Yeah.
So it's right,
Apex?
right around there
Yep.
is where you're dealing with the pain.
Any tension up here at all?
Uh-uh.
No? Okay. So what Matt is saying is he's starting to feel some of the tension coming just right off that lower angle of the mandible as the masseter just kind of runs through here. So as he's opening the jaw at the very bottom is where he feels most of that tension. So what we showed you earlier was just kind of pinning that part of the jaw and then opening your jaw as you push that tissue up superiorly or up. So same thing here. I'm just going to get a hold of Matt's jaw here. And yeah, exactly. It's right there. So one of the things that you kind of have a different type of feel as a massage therapist. The more people you kind of work on, you kind of find exactly where a person's pain is. And most people will say, how did you know? And it's because we felt this, hundreds, if not thousands of times working on people.
In your case, many years.
Yeah, after 19
with
years
this
is
stuff.
a couple few thousand
Yeah.
people.
Exactly.
So as I'm holding here, I'm going to have Matt just open his jaw really quick. Oop, and there it goes.
Fast?
No, just nice and easy, slow. And we're going to create tension by, again, pushing up towards the cheekbone superiorly. And then as Matt continuously opens the jaw, he's basically stretching that muscle, or I'm stretching the muscle for him. And Matt could feel that pretty well. So I'm just going to hold that for about 3 more seconds. 3, 2, 1. Then Matt's going to slowly close the jaw.
Ooh.
It's kind of hard to find that at a massage therapy
Oh
clinic,
my
right?
god.
You're not going to find that at Massage
At a
Envy,
spa
I don't think.
or a spa.
Or
right?
Burke Williams or anywhere
Yeah.
else. Not throwing any names out there, but I mean, ideally you're going to come to a place that deals with musculoskeletal dysfunctions or musculoskeletal health. So I'm going to check the other side. Yeah, it's not as bad on the right side. It's definitely all on the left. So now I'm going to traction posteriorly. I'm going to pull back towards me. And the same thing, Matt's just going to slowly open that jaw. There it is right there.
Whew.
5, 4, 3.
I could see your fingers like digging into that muscle.
Yeah. And
Just like
slowly
melts
close.
right into that.
And if you close up on Matt's eye, there's going to be one tear that just kind of
It
drops
starts to
down.
come down.
It's not the first time working with me, so
How did that feel?
it's like loose now.
Yeah, I mean,
Yeah.
we only
Not
did.
that like I noticed it was tight
Yeah.
before, but
I mean, we literally just did 2 passes. Now imagine if we actually sat down for like an actual session, how much more work we can kind of get in there and kind of relieve more of that pain. So What about you, Joe?
Yeah.
What you got?
So I'm going to show you a couple of things. I'm going to show you the adjustment in a seated position. There's multiple ways to adjust the jaw. But in this case, we're just going to simply drive the jaw and push the TMJ forward, so that way the discs, as I said, the discs are already forward in the front part of the jaw, so it lies anterior to his TMJ. When I adjust down and forward, the discs are going to be pushed back. And we're going to not just influence the discs, but we're going to influence all the muscles and the nerves around that area that are going to allow for a reflex reaction. That reflex reaction is going to allow the muscles to kind of balance out, to normalize for a very quick second. And that will allow, for even just a short period of time, will allow the jaw to move and glide the way we need it to. All right, and so we're going to do that today. And so first thing I'm going to do is I'm going to find his TMJ. Go ahead and open your mouth and close it. And I'm going to find it right through there. Go ahead and slowly open up halfway. There you go. Up, too far, right there. Good. So I'm going to find it right to where it kind of pushes against my finger. And I'm going to drive my adjusting hand right into that little socket and just relax your head. There we go. And as it's there, I kind of feel the joint kind of open up, push it against my hand. Relax, easy. Relax your head more. There it is.
Oh, yeah. Oh, yeah.
And so with that adjustment, as I said, it looks intense, but it's pretty smooth as we drive the jaw forward and down, right? And so that's going to kind of clear that space right there. And then we also tie that in with how the neck feels and how the neck is moving. And in his case right now, we kind of want to create a stretch reflex reaction on the left side of the neck while adjusting the right side of the neck. So in our technical terms, there's not a lot of wiggle on that right side as I push. You feel that tension right there? Mm-hmm. And not as bad on this side right over here, right? Yeah. So where we adjust based off of the dysfunctional restriction of the joints. And so in this case, we're going to be adjusting his right side of the neck. And I'm going to give you a big hug. Is that cool?
Yeah, yeah.
Cool. We got to keep the hat on while we do this. Take a deep breath for me. Inhale. Exhale. Good. And just relax your head. And I'm just grabbing his head. I'm just going to do an easy traction. Relax. Easy. There it is. An easy traction and lift to work on the suboccipitals. And look at, I'm not even pushing that hard, and it just kind of bounces over there now, right? So now we've created less of a restriction, increased movement within that upper cervical spine. And now we're trying to normalize those tissues so that way you don't deal with pain that comes above your neck, over your head, creates headaches in that area. And we are now normalizing the jaw. Now in other ways, you might have dealt with a dentist, and you might have been dealing with some stress with keeping your mouth open, or somebody locked your jaw up there. And you might not be able to close your mouth the same way. Well, in those cases, there's a few things that you might be able to do. You might want to open your jaw up as wide as you can. And now in this case, just turn your head to the side. The discs, instead of the discs in front of the jaw, they're now in the back of the TMJ. And so one of the things that we want to do, I'm going to have you just lay your head back against my stomach here, open your jaw, and I'm just going to apply pressure from down to up and slightly back, because I have to push the jaw back against that TMJ or the disc, so that way the disc kind of pops back over in front of the TMJ. So I'm just going to hold, just applying pressure back and up as you close your mouth. And I'm not going to mess him up. I don't want to mess him up so bad, but what I normally would do is I'll apply pressure from front to back, and then as I drive it up. So it's almost like an eccentric exercise, or if you guys all work out, it's a negative set for this. And I'll drive his jaw back, and it'll push that TMJ or that jaw, the discs, back over towards the front, and that'll relieve the pressure. And then all of a sudden you'll notice that your glide of your jaw is back to normal again.
So in the video, you're seeing what we're trying to do is work on the pterygoids, which are inside the mouth. So in essence, you're going to see me using my pointer finger to get between the top part of his teeth and work towards the backside of the mandible and work my way up towards the zygomatic arch, or towards the cheekbone. So as he closes his jaw, I'm now giving my pointer finger a quarter turn and kind of pinning that part of the pterygoids, that medial pterygoid. Now as I'm holding it, I'm having him slowly open his jaw, which again is creating like tension. We're creating a pin and stretch, and he's slowly trying to open his jaw as much as he can without causing himself too much pain.
And so that's the lateral pterygoid?
Medial pterygoid.
That's the medial pterygoid.
Now the more I start to drive posteriorly or drive back deeper into his mouth and a little bit more superiorly or up towards the arch, that zygomatic arch, then we start getting into a little bit of the lateral pterygoids. But primarily as I start to pull towards his cheek and then down towards his jaw, right about there, now you're going to see him again slowly open and close the jaw. And again, we're creating more space as he opens his jaw. So basically I'm forcing a stretch from inside his mouth because you can't do it any other way, really. In the video, we're working with Christian, who happens to be one of our other massage therapists here. And Christian was dealing with some jaw pain on his left side as well. And so I'm not sure if he had any trauma or not. He might have had some trauma playing sports, I think. But he had some limitation in just opening his jaw. So, you know, I checked the Temporalis, I checked the Masseter on the outside. Obviously, as he tried to open his jaw, it was very limited. One of the things he said was he likes eating burgers, and the last time he tried to eat a burger, he couldn't open his jaw wide enough to take a real bite. So, again, I threw on some gloves, worked on the other surrounding soft tissue, and then started to work on those pterygoid muscles inside his mouth. Now, again, it's not the most comfortable thing. It's actually fairly painful depending upon how much of a dysfunction you have, but you do feel much better after the treatment. So
you know, with therapies, with some of the manual therapies that we utilize, you know, a lot of people talk about, you know, pain and crying. There's a pain tolerance to it, but there's also a limitation to pain that we want to make pretty clear, right? You can't just work into pain and just say, all right, let's keep pushing pain, because that has an effect on the brain, and we don't want to affect the brain in such a negative way. We want to be able to help the situation, not add into the situation. So there's a tolerance that you're going to have to get to, and it shouldn't be, you know, a 10 out of 10 pain that you're dealing with, right? Most of our therapists ask the question like, all right, are you able to handle this? You know, how much pain on a scale of 1 to 10? So we use the visual analog scale to be able to determine how much pain you're dealing with and whether we need to back off or put a little bit more pressure into there, right? So we utilize kind of a counter irritant, so to say, right? When we're putting pressure into and making something somewhat painful, we're creating a counter irritant, so that way that ultimately when we release our hands, the pain goes down. The pain actually starts, you know, your movement is actually better.
yeah. Also, I mean, in essence, what we're thinking about is in terms of thresholds, every person has a different threshold, right? So typically we will work with your threshold, right? What pressure is good for one person won't be good for another, and vice versa. So
Absolutely.
Ideally, we're not going to try to make you cry while you're on the table. We're trying to help you as much as possible. So in essence, try to desensitize some of the things that are causing you those pains. Right?
Exactly.
So
that wraps it up here for us today. Thanks, Mark, for joining us. Thanks for talking a little bit about TMJ dysfunction. I'm sure we will have you here again be able to talk a little bit more about other areas that we can utilize soft tissue work and home remedies that you guys can deal with. Be sure to like us, subscribe to our channel, and if you have any comments, questions, be sure to write them down in the comments below. So be sure to hit us up, and we're here to try to answer as many questions as possible. Thanks, guys.
Later.